Democratic Alliance Gauteng Shadow Health MEC Jack Bloom has expressed concern that the rushed provincialization of ambulance services in Gauteng has led to disruptions of the vital role of ambulances in combating the COVID-19 crisis and responding to other medical emergencies. In a statement, Bloom says urgent arrangements should be made to ensure that ambulances in Gauteng are operational during this time. Now, to discuss this further, he joins us via Skype, and that's Jack Bloom. Thank you very much for joining us.
Good afternoon. Nice to be with you.
All right. Please take us through your observation regarding this inconvenience, regarding the move to provincialize ambulance services.
Well, I think the Gauteng Health Department has been provincializing ambulance services for some time in Gauteng. It's really centralizing it. But they've finalized the process as of the end of last month. And in the case of Tshwane, they've removed the operating license of the ambulances that are run by the city. Now, the city runs more than 70 ambulances. They've got 300 qualified staff. And as of this week, they're not providing a full service. And I think especially at this terrible time with COVID-19 crisis, when we need ambulances more than ever, I really would call on the Gauteng Health Department to reconsider and ensure that the city ambulances can operate as well, because we really need this ambulance service.
What do you think is buckling the process? Is it the bureaucracy in terms of getting the license applications approved in time? And I mean, like one would argue, do we really need to be going through this during this peak time?
Well, absolutely. And I'm still going to check if all the required procedures were followed. If you remove a license, you're supposed to give notice. And the DA in Tshwane is going to check if all the procedures were followed. But I really think at this particular time, the Gauteng Health Department has to reconsider, make sure that these ambulances can continue to operate and that we have a proper ambulance service. You know, the extra burden that ambulances have at this time is to take people who test positive to quarantine sites, to the field hospitals. And of course, there's all the normal burden of accidents and emergencies. And we need a proper ambulance service. It's not just the city of Tshwane. There's problems also in Ekurhuleni and the city of Johannesburg because the city ambulances were also providing a complementary service. And now, again, it's all been centralized, and it's something we could do without at this particular stage. The whole provincialization process, I think, has been rushed. I think it's been botched, and I think that the department should reconsider what they're doing in this area.
When it comes to forward planning and crisis management and prevention, why would anybody leave anything to the last minute for licenses to expire? And when they have to be operational, they are suspended, and the provincialization of this process is also now inconveniencing the whole process. I mean, for goodness sake, this is the peak season. Anything can happen to anybody, and patients need to be transported. Is there a need for people to be debating on whether or not what to do instead of letting the whole process unfold and let the ambulances be ready to respond to emergencies?
Well, I absolutely agree. I mean, this is no time to have bureaucratic battles, and I hope that the Gauteng Health Department rectifies this as soon as possible. You know, it's very distressing at the best of times to call an ambulance and the ambulance doesn't come. I'm getting horrific stories now of people who are calling an ambulance, and it, in some cases, can take half a day, even an entire day to arrive. So I really hope that this gets sorted out as soon as possible. I have already communicated with the Gauteng Health Department about this, and hopefully we have a speedy resolution, and all our ambulances, both city ambulances, provincial ambulances, work together and provide the best service possible, even at this very stressful time.
All right, thank you very much for making time to speak to us. We will try to actually get a right of reply from the Gauteng Health Department. And as Dr. Bandile Masuku has been out and about checking the graveside, we will also speak into the issue of ambulance services.